Let's talk fevers. For some reason in our society or even in the hospital, whenever there's a fever, we are quick to look for a fever reducing medication to keep it under control. But recent evidence is usually against it. Fevers actually help our bodies to fight infections, and they do this by stimulating our immune system and also making our body uninhabitable for the bacteria to live in. It makes it too hot for them to live in. Our immune system also works better in high temperatures, hence the heat. So fever actually is a compensatory mechanism for the body to fight away or ward off infections for certain diseases. Fevers are uncomfortable and they cause certain signs and symptoms like increased body temperature, headaches, fatigue, tiredness, reduced appetite, and irritability or restlessness. It is, however, important we monitor fevers for safety. Normal temperature limit is 37.5 degrees Celsius, and fevers is anything above 38 degrees Celsius. Most fevers in adults and children go away on their own without any treatment. We, however, do not need medication on the first site of the fever. Adequate hydration and then having enough rest can do the trick. Sometimes just taking a cold bath and then going to sleep, you wake up refreshed without any form of fever. Tips for fever treatment include tepid sponging. Now, let me describe what I mean by tepid sponging. For tepid sponging, you must use lukewarm water or tap water in a humid or hot environment. In a hot environment, tap water is normally lukewarm, but when the weather is cold, the water is normally very cold, which is actually going to increase the child's temperature or cause seizures in certain cases. This happens because when you use very cold water in tepid sponging a child, the blood vessels constrict when the water touches the skin. Less heat is able to escape and is kept in deeper parts of the body, which rather causes seizures or permanent damage to certain organs in the body. A few tips for tepid sponging. Use lukewarm water between 28 to 30 degrees Celsius. Never use cold water. When you are tepid sponging, you start from the feet and rise up so that you gradually expose the body to that cold temperature. If performed too quickly, can cause shivers and increase metabolic rate and subsequently increase core body temperature. So it has to be done slowly. Tepid sponge can be done for about 15 to 20 minutes. In humid or hot regions, tepid sponging can be beneficial, but it's no longer recommended in cold regions. Other tips for fever treatment is staying hydrated, getting enough sleep, not draping yourself with too much clothing, and then putting yourself in a cold environment to kind of drop your body temperature down naturally. Eat nutritious food because your body is using a lot of calories to fight off the infection or whatever is causing the fever in your body. In many cases, the fever will break naturally without even having to do anything, because most of our fevers are caused by viruses and can't really treat viruses. It has to run its course. When the temperature does not break after putting in these measures, or you realize that you or your child are feeling uncomfortable, you can then introduce temperature reducing medication. For children, you give them syrup, paracetamol according to their age and their weight indicated on the medication label. For adults, you can take tablets, Tylenol or paracetamol, or even ibuprofen to help with the symptoms you're experiencing. When do you need to report to the hospital for fevers? Baby under 3 months with a temperature of 38 degrees Celsius or above. Babies 3 to 6 months with temperature of 38.9 degrees Celsius or above. 6 to 24 months old with a temperature of 38.9 degrees Celsius or above for more than 1 day. 2 years old or older with a fever and also has symptoms like lethargy, vomiting, weakness. For everyone, whether old or young, if fever is accompanied by vomiting, lethargy, diarrhea, restlessness, please report to the hospital immediately. Fevers are also accompanied by stiff neck, shortness of breath, severe headache, and other unusual symptoms should also be reported immediately to the hospital for urgent treatment. It could be a sign that something life-threatening may be happening. The mistake we normally do is not fully resting and immediately popping pills, a sign of a fever. Our body has the ability to naturally heal itself, so let's give it the chance. I believe this is useful information for everybody to know. So please spread the word by sharing this video and also subscribing if you haven't already. Like and let me know in the comment section what you want me to read next. Thank you. Bye bye.